Hello, doctors. Can you hear me? Hello, good. So you can hear me, right? Okay, good. Good. Okay. Welcome, everyone. It's been a long time since we last met. I hope everyone is doing very well. And I hope that each one of you is able to continue this journey with a strong determination and great optimism, inshallah. Believe me, without these two qualities, studying will feel difficult and very, very heavy. And life may stop at points where you don't know how to move forwards. So please stay optimistic and you will find goodness ahead, inshallah. There is a wonderful saying about determination that I love it. It says, I am determined to reach my goal. I will either succeed or succeed. All right? So please try to live by it and try as much as you can to follow it, inshallah. All right? So let's go. Let's start our session. Today's session is about the skill of gathering information. Many of you have requested additional sessions on this topic. So I'm conducting another session about gathering information. Honestly, it's not just any skill. It's a very, very important one, both for your exam and for your personal and professional life. If someone lacks this skill, they won't be able to develop the ability to handle situations effectively. Without gathering information that benefits you, you won't be able to solve any challenges that you face, especially conflicts. You will end up being someone who judges situations rather than being wise. So please try to gather your information first before you judge, before you decide anything, or before you manage anything, before you advise about anything. All right? So that's why data gathering is important. Okay? So let's get started, doctors. We are going to have, can you see my screen first? Can you see my screen, doctors? Can you see the welcome word? Yes or no? Yes. Okay. Good. All right. So we are going to have the session about data gathering. What's our aim for today? Our aim for this session today to be able to gather the most important data which is relevant to the context and which will help you in managing the situation or managing the condition. Okay, this is our aim for today. How are we going to approach or reach our aim? By discussing 10 different cases with 10 different doctors. All right? You have written your name in the WhatsApp group in the list. So I'm going to pick the first 10 doctors, regardless to their exam date, because it's not a full mock exam. We are going to focus on only data gathering. Okay. So we have the first one in the list is Dr. Ahmed Imara. Are you here, Dr. Ahmed?
مع حضرتك يا دكتور.
Good. All right. Dr. Jannah. So what will happen now is that I'm going to pick Dr. Ahmed Imara first. I don't want to waste the time in searching for the doctors. We will, pick the doctors as we go based on the list. All right. If no one is, if I called the name and the name is not here, I'm going to pick the next doctor. All right. Okay. So ready, Dr. Imara. Okay.
Yes.
All right. What will happen now is that I'm going to tell you the question. All right.
Okay.
Yeah. Before we talk about before we start the mock or the cases, I just want to reiterate or highlight the main important points in data gathering before. Is that okay with you, Dr. Amara?
Yes, sure.
Okay, no worries. While I'm doing that, if you don't mind, if you are happy, if you are happy to switch your camera on, just to prepare yourself. If you can't, please tell me in the chat box or once we start. Okay. What is the data gathering? What are the main points that you gather, and what are the categories in the data gathering? Well, the data gathering, to be honest, it depends on each case. Each case has its data gathering. In PLAB2, we have many approaches. Okay. And the first approach is history-based approach. Okay. In history-based approach, you deal with a patient. The patient comes to you with a specific symptom. You are going to ask this patient a sequence of questions to be able to reach the provisional diagnosis. All right. So the data gathering always related to three main complementary categories, which are history, examination, and investigations. This is for history-based cases. In other approaches, we can skip examination in some cases. In some cases, we can skip investigations. But usually, in the other approaches, history is important. Taking history is important. Okay? So it's based on the approach. If it's history-taking case or history-based approach, you will need to fulfill these three complementary categories. But in other approaches, we can skip examination or investigations. Okay. In the history taking, we have 5 P's. 1, 2, 3, 4. 4 P's and ICE. Okay. We have 4 P's here. So we have present, past, personal, 4 P's, psychosocial, and ICE. If we can put them in, all of them start with P. So we have 5 P's in addition to the 4 P's with ICE. Okay. These are the main categories of history taking. All right. My question is, do we need to ask all of these categories in each single case? Yes or no, doctors?
I think no.
Yes, no. So I do agree with you. So we can't ask or fulfill all of these categories in each single case. Well, it depends on the case. It depends on the context. It depends on the question. Okay. Let's say that we have a patient who is elderly, comes with acute symptom. Elderly patient comes with acute symptom. What are the categories that you need to fulfill from these categories. Any idea? Acute symptom in an elderly patient.
The present and past.
Yes, present and past are very important. It's acute symptom, so you have to explore the symptom very, very well and exclude your red flags from the present history. You have to check if it happened before or if there is any medical condition can cause this acute symptom. Yes, I do agree with that. Do you think personal history, which is diet, exercise, smoking, and alcohol, is important in this case? I need your ideas,
Maybe it's
doctor.
related.
Sorry?
Maybe it's related, like if
In,
one
in,
have
in
specific.
some cases, but if we can speak generally, personal history, diet, exercise, smoking, and alcohol usually is important in chronic symptoms. Okay?
Yes.
All right. So in some cases, we can skip personal history with acute symptoms. Do you think psychosocial is important in an elderly patient?
It's important, but not in acute symptoms or acute setting.
Well, no, I can't agree with you in this situation because the patient is elderly, all right? An elderly patient, you have to find his ability to deal with daily life activity. What about his mobility? How is he moving about? How is his home condition, especially if he's very, very old, maybe above 70. Okay, so psychosocial is important or extremely important in elderly patients. So it's crucial to read your question carefully to find out what is the age of your patient, okay? And based on the age, you can deal with the categories of history taking, okay? Usually in psychosocial, we deal with the effect of this problem on daily life and on job. This is the first point. The second point, you have to consider asking about job and driving. The next point is asking about who does the patient live with, his dependency as well. Is he dependent or not? Or how is he dealing with his daily life activity, his mobility? How is he moving about? Is he using crutches or walker, or he's totally independent? So it's very important to find out the answers of these questions in elderly patients. All right? Okay. Do you think asking about ideas, concerns, and expectations in this case important or not?
I think yes.
Yes, in each case, in each single case in PLAB2, you have to ask about ideas, concerns, and expectations. All right? Let's take another example. A patient who is young age. This young patient came in with acute symptom. So young patient with acute symptom. Which category in these categories is important?
Maybe all of them.
Present and past are important. Personal, we can skip it in
Okay.
most of acute symptoms. So please, doctors, any acute or sudden symptom, please try as much as you can to avoid diet, exercise, smoking, and alcohol, unless they are very, very, very related to the symptom and you are going to mention them in the management. If you're not going to mention them in the management, if they are not extremely related to the symptom, avoid asking about personal history. And this is not from my mind, it's from the GMC criteria of marking. Okay? All right. So we can say present and past is important. Psychosocial, we can pick up the effect of this problem on the patient's life or job. If it's like for 3 days or 4 days or 1 week. So we have to consider asking about effect of this problem and ideas, concerns, and expectations. So our data gathering should be based on the question, the context, and the situation. All right? You don't need to ask all of these coins or categories in each single case. Am I clear, doctors?
Yes.
Is it clear? All right, good. After taking your history, you should be able to examine the patient. You check the patient's observations, and if it's needed, you can verbalize, I'm going to do a general physical examination in addition to the local examination. The local based on the case. Let's say a patient who comes with chest pain. So you have to do cardiovascular examination for the chest and heart. Okay? So this is the meaning of local examination. Okay? After doing the examination, you order your basic investigations based on the case. Can I ask the doctor who is writing on the screen to stop sharing his or her screen? Because it's a bit distracting for me, if you don't mind, and for others as well. I think who's writing is, I'm not sure who it. Thank you, thank you. Thank you so much. All right. After examination, you investigate. In your investigation, you consider ordering bloods, basic bloods, samples like urine sample, swabs if it's needed from a wound or from the throat or from the nose or from any secretion, and imaging. In imaging, you can think about ECG, ultrasound, X-ray, CT, based on the case. Okay, and usually we start with the basic investigations. Okay, bloods, samples and swabs, and ECG and X-ray first, and then we can consider the other advanced investigations. Okay, doctors. In ethics cases, the examination and investigations are not important, especially if you are talking with a relative. Okay, you consider asking about present and psychosocial and ICE, mostly in most of the cases of ethics. Okay, so it's based on the approach, to be honest. I just wanted to highlight what are the categories of your data gathering and how to deal with each category based on the approach and on the situation itself. Okay? Any question before we move? Any question, doctors? Yes or no? Do you hear me, doctors?
Yes, doctor, we hear you. No
Okay.
question.
All right, no worries. So this is a quick highlight on the data gathering. So are you ready, Dr. Ahmed, صح? Dr. Ahmed or
Yes,
Mohammed?
yes.
Ahmed, okay. So yes, do you want to switch your camera on or? Okay, good. But I can see the ceiling. Well, okay, Dr. Ahmed. Dr. Hikmet, if you can just switch your camera off. Yeah, good. Ready, Dr. Ahmed?
Yes.
Good. All right. So the question is a history-based case, okay? It's a
Okay.
history-based case. I'm going to read the question for you now. then you will have 5 minutes to gather your data. We are focusing only on data gathering, okay?
Okay.
Just data gathering. We will stop at the investigation point. So after the investigation, we don't want to, go further.
Okay.
5 minutes is more than enough for taking history. I would advise if you just take your data gathering in 4 minutes, less than 5 minutes, okay? This will be a very, very good time management, okay?
Okay.
Yeah. Just let me find the timer. Yeah. Okay. Yeah. So you are talking with Mrs. Elena White. Okay. She is 29 years old lady. Came in the A&E.
Okay.
Presenting with dizziness. Okay. Presenting with dizziness. Your
Okay.
task is please talk to the patient, take a focused history, assess the patient, and discuss the management plan with the patient.
Okay.
All right?
All right.
Ready?
Yes.
Okay, just give me a second to start the timer and off you go.
Hello, I'm Dr. Ali. I'm one of the treatment doctors here in the emergency department. I believe I'm speaking to Elena White. Is that right?
Yes, doctor.
So shall I call you Elena for today?
Yeah, it's fine, doctor. Elena's good.
Okay. Could you confirm your age for me, please?
I'm 29 years old, doctor.
See, Elena. So I can see from my notes, Elena, that you came here with some dizziness. Is that right?
Yeah, yes, doctor.
So could you tell me more about that, please?
Well, I don't know, doctor. It started in the morning, and all of the sudden, I was in doing my shopping, and then I was just
Huh?
trying to pick something up from the shelf, and then I felt sudden dizziness, and I was about to fall, and then the security helped me, and the ambulance came.
Okay, I'm really sorry to hear that. It must have been a difficult experience for you. But could you tell me,
Yeah,
yes, could you tell me if this is the first time for that to happen?
yeah, it's the first time, doctor.
Okay, so could you think of anything that might have triggered it?
Um, It was just, moving my head. I was just trying to pick something from the shelf, and then I felt that. I don't know.
Okay, so before that, did you have any fever?
No,
Okay, did you miss any of your meals?
no,
Did you have any heart racing?
no,
Okay, so during this episode of dizziness, you mentioned that you didn't feel. Is that right?
no. I was about to fall down. Yeah.
Okay, and was there any loss of consciousness?
No.
Okay, great. And after that, do you feel any nausea?
Oh, yeah, I feel sick. Yeah.
Okay, did you vomit?
No, they provided me with this kidney tray just in case if I vomit.
I can see. Okay, so you feel that you want to vomit.
Mm. No, I didn't
Okay,
vomit. No.
okay. Do you have any numbness or weakness anywhere in your body?
No,
Okay, you mentioned that you don't have any heart racing, is that right?
no,
So, do you feel tired most of the time?
no, doctor.
Okay, great. So, going into your general health, do you have any long-term medical condition should be aware of?
No, I'm fit and well, doctor.
So, great. Are you on any medication?
No.
Okay. Do you have any allergies?
No, doctor.
Okay. Do you have any vision problem?
No,
What about your hearing? Any hearing problem?
no, no.
Okay. So I can see that you've been in a difficult situation. So do you have anyone around to support you?
Yes, I have my husband at home. Yeah,
No, I'm really glad to hear that you have a supporting husband.
thank you, doctor.
So, Alina, do you have any idea why it might be going on with you?
No,
Okay. Do you have any concerns at the moment?
I just want to know what's going on and something to help me in this sickness. It's very bad feeling.
I can see that you're concerned about this sickness, and for sure I will be of help today, but I need to ask you a couple of questions first.
Mm-hmm.
Is that okay?
Yeah,
So, do you have any expectations from today's visit?
nothing specific, doctor.
Okay, great. Thank you, Elena, for answering all my questions. Actually, now I'd like to examine you. I'd like to check your observation, your blood pressure, your breathing rate, your heart rate, and your oxygen saturation and temperature.
Mm-hmm.
I also want to do general physical examination,
Mm-hmm.
um, and also a hearing test. Is that okay?
Okay. All right.
Uh, so so now we need also to do further investigations. We need to do
Time's
uh,
up. 5 minutes. All right. Okay. Thank you, Dr. Ahmed. So, how do you feel?
مش عارف يعني مش أحسن حاجة بس يعني تمام.
Okay, so why do you feel it's not
عشان ما
great
كنتش
or
حاسس نفسي اللي أنا organized، كنت حاسس نفسي اللي أنا بجيب سؤال من هنا وسؤال من هنا، ما كنتش حاسس
no?
اللي
Or,
أنا
so you feel that there is no organization
yes.
and okay. All right. And what is your provisional diagnosis for this case?
أم، بصراحة ما قدرتش أوصل لدايجنوزس، بس كان عندي حاجات كتير قوي. يعني كنت متوقع إن أنا هشوف حاجة في الإكزامينيشن أو حاجة زي كده، بس ممكن تكون أنيميا، ممكن تكون مش عارف. ما قدرتش أوصل للبروفيشنال بصراحة.
All right. Okay. No worries. No worries. No worries at all. Okay. So this is the art of data gathering. If you gather specific things or specific points in your history, you would have reached the provisional diagnosis. Okay? No worries. We are going to discuss what you missed and what should be done. All right. Okay. So I do agree with you. There is a bit of disorganization, a bit of disorganization. You asked your present history, okay? Then you moved to the past history. Then you went again to ask about hearing problem and headache and vision. A bit of disorganization. This is not this is not a very big deal. Okay,
Okay.
leave it aside. Okay. My concern is asking the right specific questions which are to the point. Okay. All right. Dizziness. Dizziness. In any dizziness, you have to find out. Firstly, what do you mean by dizziness? What do you mean by dizziness? Is it you are about to faint or the room is spinning around you? Okay? The room is spinning around the patient, so this is most probably something related to
Hearing.
ear,
Eerie.
inner ear, to the balance. Okay? So What do you mean by dizziness? You asked me about when did it start. Then you didn't ask me, is it episodic or not? Okay, just let me mute all. Is it episodic or not? Okay, all right. So what do you mean? Is it episodic? How frequent? And then it is an event you ask about before, during, and after. Okay, before this, anything specific happened, and then you take the patient from up downwards, any headache, any vision problem, any problem in your hearing, okay, and any pain in your ear, because the room is spinning, so something related to the ear. So you ask about any pain in the ear, any something mnemonic called DVTF, deafness, vertigo, the patient has vertigo, T for tinnitus, any ringing sensation, any fullness in your ear, okay? Then after that, you asked about facial weakness and arm weakness, and lastly, heart racing, okay? All right? Then during, this is before, okay? During, what happened? Do you have, for how long did it last? Okay? If it's seconds, so it's related to benign positional vertigo. The patient can change his movement right away in seconds. So if it's in seconds, this is benign positional vertigo. If it's for minutes for many years, okay? Vestibular neuritis, the patient will have dizziness for a longer time, okay? How long, please, for during? How long did it last? Did you lose your consciousness? Okay, you've done that. All right. Then after, did you have any fall? I told you I don't have any fall, and I didn't injure myself. Okay. So this is how to explore. Okay. Then you move on to the past history. Did that happen before? Any medical conditions? Any medications? Allergies is not important. Do you think allergies? If you ask about allergies, will it help you? No. Leave it. Okay. Psychosocial. Psychosocial is crucial here. Psychosocial is crucial, okay? Here, okay? Why? The patient has dizziness. Who does he live with? Is he living alone or not? I don't mind about support, okay? So almost all of you is focusing on, do you have enough support in any medical condition? And this is not really a relevant question, okay? So who does you live with? Who do you live with? What else? How about your safety at home? Do you think that the home condition is not safe? And also his job, her job, the patient. Maybe she's driving. Okay, all right, job and driving. So psychosocial is important in this case. So this is the art of dealing with data gathering to find out the symptom and what are the categories which are related to this specific symptom. Okay? You pick up the questions in the categories based on that. Do you think asking about smoking, diet, exercise are important in this case? No. So personal history is not important in this case. Okay? Then ideas, concerns, and expectations. Then you examine the patient, examination, check your observations, general physical examination, and what is related to this case? Ear examination, heart examination, okay, and two specific tests, Dix-Hallpike maneuver and head impulse test. If head impulse test is specific for vestibular neuritis, okay? And Dix-Hallpike maneuver is specific for the
benign positional
benign positional vertigo, okay? You can ask for investigations from now, check bloods for the patient to exclude anemia and ECG, full blood count and ECG. So these are the most important points in your data gathering in any dizziness. Okay?
Okay.
In your present history, you missed many points, to be honest. And then you just, is it? Okay, just give me a second just to charge the. Okay. So what do you mean by how frequent do you have, is it episodic or not? How frequent? Did you have any infection before? And psychosocial.
Yes.
Psychosocial, you missed it. All of it. And in examination, please mention specific tests. One is called Dix-Hallpike and the other one is head impulse test. Okay. Head impulse test. Head impulse test. It's a specific, not only for vestibular neuritis, but to exclude stroke as well. Okay.
Okay.
All right. So yeah. All right. Got me, Dr. Ahmed.
Yes.
Okay.
Yes, doctor. Yes.
All right. Was it helpful?
Great. Yes.
Okay, good. All right. So inshallah, any dizziness, you will be, on top of everything.
Inshallah.
Okay.
Inshallah.
All right.
Thank you, doctor.
Thank you, Dr. Muhammad, Ahmed. Okay, so let's do the next case, doctors. So again, this is history-based case, dealing with a symptom, and we talked about how to gather the data here. History, examination, and investigations, complementary to each other in this case to reach the provisional diagnosis. Okay? All right. Let's do the next case. Who's ready? Let me see the Dr. Jannah. Dr. Jannah, are you here? Not here. Dr. Ahmed Dirbala. Dr. Ahmed Dirbala. Again, the last call. Dr. Ahmed Dirbala. Okay. Dr. Pradipan. Pradipan again. Okay. Dr. Aya Hassan.
Yes, doctor.
Ready, Dr. Aya?
Yes, yes, doctor.
Okay, we are in the second doctor. Just remind me, doctors, if I'm lost. So we are in the second with the second doctor. Okay. All right. Happy to switch your camera on.
It will be hard now. Sorry, doctor.
Okay, no worries, it's fine.
Thank you.
Okay. So the case is yeah. You are talking with a patient, Mrs. Whatever, Becca Longfoot, okay? Mrs. Becca Longfoot. She is 35 years old. She came in today for her pre-operative assessment for laparoscopic cholecystectomy. Okay?
Yes.
Pre-operative assessment for laparoscopic cholecystectomy. Okay?
Yes.
Your task is talk to the patient, take a focused history, assess the patient, and address her concerns.
Okay.
Okay? Ready? Do you want 1 minute to prepare your mind?
Yeah, just a second. Yes.
Okay, no worries.
It's Becca Longfoot.
Yes.
Yeah. Okay, 35 laparoscopic assessment. Okay. Okay. Okay, doctor, ready.
Ready?
Okay.
Okay. Before I start, one last thing to Dr. Ahmed. I was holding this kidney tray or a plate. Just pick up any non-verbal clue. Pick up any non-verbal clue. If the patient is holding a kidney tray or holding his head or just showing pain or angry or whatever he does, please pick it up. How to pick it up? I can see. I can see that you are holding a kidney tray. Are you feeling sick? I can see that you are holding your head. Do you feel any pain? I can see that you are holding your back. Are you feeling any pain? I can see. Okay? Pick up the nonverbal clues. This is part of your data gathering and listening as well. Listening, picking up the clues. Okay?
Okay, doctor, thank you.
Yeah, no worries. So let's start, Dr.
Yes, Dr. Zahra.
Dr. Aya.
Yeah, ready. Okay.
Start.
Okay. Hello, I am Dr. Hassan, one of the doctors here. Are you Mrs. Pika Longfoot?
Yes, doctor.
Okay, but could you please confirm your age for me?
Yes, I'm 35 years old.
Okay, so I understand, Mrs. Longfoot, that you came today because of your pre-operative assessment. Am I right?
Yes, doctor.
Okay, so before we discuss about this, could you please tell me how much do you know about your surgery?
I don't know very much, doctor. If you can help me in that, I would be grateful for
Yeah.
you.
Of course, I'll be happy to discuss everything with you, but before that, do you have any specific concern we want us to focus on today?
Not for now, doctor.
Okay, so I understand that you came because you have been prepared to do laparoscopic cholecystectomy. Am I
Yeah.
right?
Yeah.
So do you have any symptoms now?
No, I don't have any symptom. Symptoms like what, doctor?
Do you have any abdominal pain?
No,
Any fever?
no.
Okay, that's good. Uh, so regarding to your general health, have you been diagnosed with any um, blood clotting problem?
No.
Any problem with your mobility before?
Mobility, no.
So, do you have any blood disorders?
No.
Okay, so are you taking any blood thinner medication?
No.
Any family history for any blood disorder problem as well?
No, doctor.
Okay, that's good. Do you have you done any surgery before?
No, I didn't have any surgeries before.
Um, any problem with anesthesia before?
No.
Okay, any problem in your mouth?
No.
Okay. Are you taking any medication for any reason?
I'm just taking beta blockers for sumatriptan for migraine.
Or migraine? Any other medical disease rather
No.
than migraine? Any other medication rather than sumatriptan?
No.
Okay, that's good. Are you taking any contraceptive pills?
No, doctor.
Yes, that's good. So, okay. Um, regarding to your, uh, you know, lifestyle, do you smoke?
No.
Okay. Do you drink alcohol?
Just occasionally, doctor.
Yes, that's good. So, okay. May I know with whom do you live with at home, Mrs. Longfoot?
I'm living alone, doctor.
Okay. Do you have enough support around you? I mean, after the surgery, anyone who will look after you?
I'm not sure. Is it something important?
Yeah, maybe after the operation, we need someone to be with you, maybe for the first 24 hours or 48 hours.
Oh,
Do you have
okay.
anyone?
Oh, I didn't think about that. Okay. Yeah, I can arrange for someone to be with me.
Yeah, that would be very good.
Okay.
So, may I know what do you do for living, Mrs. Longford?
I'm a housewife.
Okay. So, um, uh, okay. For now, okay. Um, we will do, after listening to you, I would like to explain to you what the examinations and the investigations that we will need to do as a pre-assessment for your operation. Is that okay?
Okay, doctor.
First, I would like to take your observation, I mean your temperature and your blood pressure, your heart rate, and your breathing rate, and your oxygen in blood, and I will do general examination. And we will do heart tracing and do some blood tests. It means to know exactly your blood group and to save blood as well. And we will
Okay.
check your.
Time is up. Okay. Thank you, Dr. Aya. Okay, how do you feel?
It wasn't, it wasn't sure with me to explain the operation for her in the beginning, or it is part from the management.
Yeah, it's
So
part of the management.
yeah. So regarding to the idea, I asked the concern in the beginning.
Mm-hmm.
We have a specific concern to discuss, but I think about the idea, but it wasn't clear with me. What should I ask here?
Okay, this I will answer you how to ask the idea here in this case.
And the expectation as well, because I thought her expectation is to know everything about the operation. So
Okay.
yeah,
Anything else?
time management, I didn't explain the investigation and the examination. I think it's the main part in this station to tell her exactly what is the
Yeah, examination is important.
examination
It's part of your
investigation.
assessment.
Yeah,
And investigations as well, because it's preoperative assessment, like
yeah. It's
basic bloods, ECG,
mm-mm.
COVID swab and MRSA,
Yeah,
right?
everything. Yeah, it's the main
Yeah.
part. Yeah, in this station.
Swabs. Yeah. Okay. All right.
Okay.
Okay. There is another issue. In this case, we are not going to focus on this issue now because it's not our focus. Our focus is data gathering. Data gathering, okay, of the case. What if I started by telling you, yes, doctor, I do have a concern from the start. I don't want any blood to be transfused to me
Mm.
from the start. What would be your data gathering then?
So I still will. I will tell her. I will talk with you in this in a minute, and I will do the same. I think.
Okay, and after that, after doing all of your data gathering, what are you
I will
going?
ask her why and start to talk with her. If she refuse again, I will talk about the benefits and risk. And if she refused,
Okay,
yeah,
why
just
am I asking you this question?
it's early to ask. Yeah.
No, why I'm asking you, if her concern is she doesn't want any blood transfusion, what would be the data gathering? Because
Mhm.
asking her why you don't want to have any blood and asking her how much do you understand about the consequence of not receiving blood is part of your data gathering.
Mm.
Okay,
Yeah.
all right. So
Yeah.
she is concerned about not receiving blood because maybe she's Jehovah Witness, so her religion is against that. So you have to ask her why, and then you check her understanding. You tell her, how much do you know about the consequence of not receiving blood? Do you know that if you need any blood, this might affect your life? It could be life-threatening if you don't receive any blood and your condition needs that. It's very important.
Yeah.
Okay, so this is part of your data gathering, right?
Yeah.
That's why I'm telling you, doctors, data gathering is important. Data gathering is extremely important. It will help you in the rest of the case, the rest of each case. Okay? If you think about your data gathering from this perspective, I think you will be able to deal with any case. Okay? If her concern is not that from the start, if she's not concerned about that from the start, then you deal with the case as if it is just preoperative assessment. Okay? Once she raises this concern, then you have to ask these two questions because it is part of your data gathering. If you don't ask these two questions, because it's one of the this concern is one of the main issues of this case, your data gathering will be very, very low. Okay?
Okay.
All right. So, yeah, preoperative assessment. Any preoperative assessment, you need to gather some data about the patient in general. Does she have any symptoms to find if she has any pain in her, if she still has any pain in her abdomen or any inflammation in her abdomen, so you will postpone the surgery. So each question has its purpose, okay? If she has any medical condition, you will try to find if we need to postpone the case or not based on the medical condition. She doesn't have any problem. You just need to advise her to stop sumatriptan 24 hours before the surgery, and that's it, okay? So in any preoperative assessment, as I mentioned, you ask the patient what happened exactly, or you recap with her. I can see that you are coming for preoperative assessment for removal of the gallbladder. Avoid medical jargons. Maybe she doesn't know what is laparoscopic cholecystectomy, okay? Removal of your gallbladder by a keyhole surgery. Is that right? Yes. Okay, so this is your preoperative assessment. I'm going to ask you some questions and then examine you, take some bloods as part of your assessment. Is that okay with you? Yes, doctor. All right, then you take your history. In the present history, what you need to ask, how is the patient now? Does she have any pain, fever, nausea, vomiting, any symptom can cause postpone of the case or the surgery? Just give me a second, doctor. Okay. Then you can just systemic review, ask about some questions as a systemic review. You have any headache, any chest pains, or any chest symptoms, any urinary problems, any kidney or liver diseases? Okay, you can do the systemic review in the past history, whatever you want. Okay, then in the past history, you have to find out did she have any surgeries before, especially in the abdomen, any medical conditions that she has, or any medications that she's on, any allergies, especially anesthesia, allergy for anesthesia, any problem with the anesthesia before. This is in the past history. In personal history, you can ask about smoking and alcohol. In psychosocial is important here in this case. It will be a daycare case surgery, so you have to ask who does she live with, can she arrange someone to be with her in the next 48 hours or not? Okay, because it's a daycare surgery. Then ideas, concerns, and expectation. Do you have any concerns? If she raised her concern, I told you how to ask the questions or what are the questions in your data gathering. Once she raised the concern, ideas, how to ask ideas here. You can tell her, do you have any idea about how the surgery will be done? Do you have any idea how the surgery will be done? Or do you have any idea about what are the consequences of your decision? Okay, so you can ask ideas by many ways. Okay, then you check observations, general physical examination and abdominal examination, please. Investigate for bloods, urine sample, what are the swabs, COVID and MRSA and ECG. Okay,
Okay.
all right.
Yeah.
So yeah, okay.
So the question of how much do you know about the surgery or about the procedure or anything like that in the beginning, is it enough to cover the idea or I need to?
Yeah, it's enough. Yeah,
Yeah.
yeah,
Okay.
yeah, it is enough, more than enough. Okay.
Okay, thank you.
Yes. So you asked, you know, the questions that are important to the case here. You also covered asking about pills. Can ask about pregnancy. Any chance you might be pregnant? Okay. But I felt that you were a bit, you know, hesitant or not very confident in asking your questions.
Yeah, I feel sometimes I think about it's relevant or irrelevant, and
It's good.
yeah,
It's
yeah,
good to do that.
it seems
By
yeah.
time,
Mm.
by time you will find that you're not thinking. So it's good. It's a good point that you think about if it's relevant or not relevant. Okay.
Yeah.
So by time you find that yes, I'm getting confident with the just I'm doing
So
it.
regarding
by
to the
heart.
pills and the blood thinners and all of this, is it enough to say any medical problem and any medication will cover, or I need to specify?
No, you don't need to specify.
Yeah. Okay.
Okay. Any medical conditions that you have, any medications, if they want to raise something, they will tell you. Okay.
Okay. Okay. Thank you so much.
All right. Thank you. There are some questions here. I didn't understand the part of asking about blood transfusion. Well, Dr. Hikmat, she is refusing blood. She doesn't want to have any blood if her condition needs that. So you have to find out why she's refusing. She's refusing something, okay? In any surgery, there is a possibility that the patient might have, you know, an indication for blood transfusion, okay? So you have to find out why she is refusing, and you have to find out what is her understanding about the consequence of not receiving blood. I hope that I answered your question. If I didn't answer, please raise your hand or just switch your mic on. What are the investigations? We have talked about it. Should explain the surgery or just the assessment and tell her that.
Dr. Sahar,
Yeah, who is talking?
I'm Dr. Hikmat.
Yes, Dr. Hikmat.
Yes, Dr. Sahar, I would like to know, shall I need in pre-op assessment to ask her, maybe you need in during the surgery, you need blood transfusion, or I go through this, or no need to ask? Shall I need to in pre-op assessment to ask her about blood transfusion? Do you have or no?
Do you mean, do you need, is it important to ask the patient by yourself without the patient raising this concern?
By myself, yeah.
Okay, it's fine.
Okay.
It's fine. It's fine to ask her.
But if I not ask, no problem.
If
I
you don't
didn't
ask,
ask,
if you don't ask, it's okay.
no problem. Okay. So
Yeah.
I didn't ask.
Yeah,
Okay.
no, you can ask. Why not? Because it's any surgery needs. There is an indication for blood transfusion. Yes, cholecystectomy is the bleeding is very low. The chance is low, but yes, why not? You can ask.
Okay.
Yeah. Should I
Oh,
explain the surgery or just the
you look.
assessment? And thank you, darling. Should I explain the surgery or just the assessment and tell her that the surgeon will explain? So, your question is about the management, okay? Yes, you explain if it's her concern. Yes, you explain if it's her concern, okay? If it's not her concern, so you just verbalize that you're going to discuss with her how the surgery will be done at the end of the consultation, okay? So it's based on the concern of the patient, okay? And your task as well. If your task is explain the surgery to the patient, so this is your task. If you don't do it, you're not going to have the mark. All right? Okay. Well, let's do the next case, doctors. um, Dr. Isra.
Hello, doctor.
Dr. Isra Al-Gindi.
Yes, doctor, I'm with you.
Hello, Dr. Isra. Okay, let's do the case. If you're happy to switch your camera on, please do that. If you are not happy, it's fine. So, what is the next case? Did you practice with me before?
Yes, I practiced before with you.
Yeah, okay. All right. Did you do counseling or?
No,
I can't remember.
no,
Okay.
I can't remember, but I think it was a medical history.
Okay, no worries, no worries.
Okay.
Okay. Let's do the next case. You are talking with Mr. Paul Bernard. He is 50 years old. He had myocardial infarction and he's admitted in the hospital for 2 days. He's about to be discharged today. Additional information, you've been asked to talk to the patient. Your task, please talk to the patient, assess the patient, and discuss with him about some lifestyle modification.
I'm sorry, doctor, I will not be able to open the camera.
It's fine, it's fine.
Okay.
Okay, but did you get what is the question and what is the task?
Yeah.
Okay, all right. Do you want me to say it again?
Yes.
Okay. You are talking with Mr. Paul Bernard, 50 years old, in the hospital. The patient has had MI and he's admitted in the hospital for 2 days. He's going to be discharged today. You've been asked to talk to the patient. Your task is please talk to the patient, assess the patient, and discuss with him lifestyle modification. This is your task. Talk to the patient, assess the patient, and discuss with him lifestyle modification. All right?
Yes, doctor.
For all of you doctors, this is your task. So gather your data based on your task. Assess the patient and discuss the management, lifestyle modification with the patient. Okay?
Okay. Yes, doctor.
All right. You have 5 minutes.
Hello, good morning. I'm Dr. Genji. I'm one of the doctors here.
Can you just talk, speak up a bit, if you don't mind?
Yeah, okay, doctor. Hello, I'm Dr. Genji. I'm one of the doctors here. Are you Mr. Paul Barnard?
Yes, doctor.
Hello, Mr. Barnard. Can you confirm your age for me, please?
I'm 50 years old, doctor.
I understand, Mr. Barnard, that you have been admitted 2 days ago in the hospital due to myocardial infarction. Am I right?
Well, yes, I had a heart attack. Is it what you say?
Yeah, yes,
Okay.
Mr. Barnard.
Yeah.
So, how much do you know about your condition?
Well, they told me it's a block in the blood supply of my heart.
Mm-hmm.
Yeah.
Yeah, that's right.
Mhm.
And what symptoms brought you to the hospital?
Oh, so it was severe chest pain and chest tightness as well.
Mm-hmm. Uh, and um, and what tests did they do when you came to the hospital?
Well, they've done many tests, some bloods, ECG, X-ray, many things.
Mm-hmm. And what have you been told so far about that?
About the investigations or about my condition.
Yeah, about your investigations and your condition.
Yeah, they told me that I have a heart attack.
Yeah, okay. And do you know what the treatment did they give you?
Yes, one of your colleagues talked with me about the medications.
Mm-hmm. And how are you doing now, Mr. Barnard?
I'm doing well. I'm okay.
Do you have any symptoms at all now?
Symptoms like what, doctor?
Do you have any chest pain now?
No,
Any difficulty in breathing?
no,
And do you have any leg swelling?
no,
Any leg pain?
no.
Okay. A few more questions about your general health, Mr. Barnard. Have you been
Okay.
diagnosed with any medical problem rather than this heart attack this time?
Yes, I have high blood pressure.
Mm-hmm. And what do you take for this?
I'm taking amlodipine.
And are you compliant with taking your medication?
Yeah, I'm taking it as
And is your blood pressure well controlled?
yes,
Okay, perfect. And do you take any other regular medications?
no.
Has anyone in your family been diagnosed with heart problem or strokes?
My dad had a heart attack.
Mm-hmm. And do you smoke, Mr. Barnard?
Yes, I do smoke. I'm a heavy smoker.
Yeah. How much cigarettes do you smoke per day?
Well, I would say 30 cigarettes per day.
For how long have you been smoking?
Since I was teenage.
Yeah, it's a long time. So, and do you drink alcohol?
Just occasionally.
Okay. And what about your eating habits? Do you consider yourself eating healthy diets?
Well, yes, I'm eating healthy. I eat grilled food and vegetables. I don't eat fast food. Yeah.
Okay, perfect. And do you drink enough water per day?
Not really.
Mm-hmm. And do you practice exercises on regular basis?
Yeah, I do walk every day for 15 or 30 minutes.
Mm-hmm. And you told me that this just been for about 3 days now. Has it stopped you from doing anything at all?
No, once I had the chest pain, I went to the hospital right away.
Mm-hmm. And what do you do for a living, Mr. Barnold?
I'm a taxi driver.
Okay. Do you have any concern for me to explain anything to you?
No concerns for me.
Okay. So I would like to examine you now. I will check your observations, your heart rate, your breathing rate, your blood pressure,
Mm-hmm.
and your temperature. And also I will do a chest examination,
Mm-hmm.
listen to your heart and listen to your lung, and examine your legs as well. And
Okay, doctor.
okay, and we will do a heart tracing for you. Is that okay, Mr. Barnard?
Okay, is it something, you know, easy, the heart tracing? I've done it before. Are you going to do another one?
It's only to like checking
Okay,
before
time is
the
up.
score.
Time is up.
Thank you.
Okay. Thank you, Dr.
Isra.
Isra. How do you feel?
Yeah, I'm a little bit confused about this case. Yeah.
Why?
No, because I read it, but since a long time, so
Mhm. Okay, good.
I was trying
Well,
to, yeah.
you've done it well. You've
Okay,
done it
thank
well.
you.
The only thing that I would say, you don't really need to ask the patient what investigations did they do and what they did tell. You asked me once, twice, what did they tell you about your condition? So only one, you know, you asked me twice this question. So only once is okay. You don't really need to ask the patient, you know, any investigations, what are the investigations? Did they tell you anything about the investigations? Okay?
Yeah,
It's not going to help you. What is
yeah,
your
yeah, I
task?
know.
Yeah, what's your task? Your
Uh,
task is assessing the patient and talk about lifestyle. So how to assess the patient? Assessment of the patient by finding out, does he still have the symptoms now or not? Does he have any medical conditions? Check the observation of the patient, examine his heart, and then do another ECG. Okay, this is your assessment. This is how to assess the patient. Okay?
yes,
The other task, what is it? Lifestyle
lifestyle.
modification. So you talk about, you ask the patient about his lifestyle. Okay? And in addition, psychosocial is important, his job. Maybe he's driving, maybe he's a taxi driver, maybe he drives his car. Okay? So driving and job is important. Okay? Yeah. So you've done it well. You've done it well. I'm happy with your questions and the data gathering, to be honest.
Thank you.
Okay?
Yeah, thank you, Dr. Sar. Thank
Oh,
you.
no worries. So yeah. So this is how to think about the data gathering, doctors. Find out the situation. What's your task? And gather your data based on it. If you can put this case in a specific category, it's it's a counseling case, and I put it in my course in a reviewing counseling patient. Okay, you are counseling a patient by reviewing the patient. Okay, this patient doesn't have any new symptom, so you just need to find out how is he now, what are the symptoms that he has, the risk factors of having myocardial infarction, and then the personal history, psychosocial history, and as part of your assessment, because this is your task or one of the tasks, you have to examine the patient and to redo ECG. Okay? Not it, doctors. All right.
And doctor, you asked me why will you do another ECG? So, what will be the appropriate response for that?
Yeah, well, tell him, okay, we tend to do another ECG just to make sure that there is no any and there is not no change, no more changes after having the heart attack, and you don't have any, to make sure that you don't have any more problem.
Okay, thank you.
Okay, all right. Or you can review the ECG of the patient. Both of them are right. Reviewing his ECG or order another ECG, but just, you know, highlight that you're going to check the ECG. Okay. All right. Let's do the next case. Who is next? Dr. Muhammad Salim. Dr. Muhammad Salim. Hello. The last call. Dr. Muhammad Salim. Okay. Dr. Isra Ali. Dr. Isra Ali.
I hear you, doctor, but just give me a couple of minutes. I'm dropping my kid into the nursery.
Okay. If you are not able to do, I can pick someone and then come again to you.
Yeah, that would be perfect. Thank you.
Okay. No worries. Just remind me, please. Just remind me in the next case. Dr. Afra. Dr. Afra Abdul Mu'ti. Okay. Dr. Furkan Cook. Dr. Furkan. Again, last call. Dr. Furkan. All right. Dr. Rawan Rifat. Dr. Rawan. Hello. Dr. Rawan. Okay. Dr. Alauddin. Dr. Alauddin. Okay. Dr. Hikmat. Dr. Hikmat, I think you are here. I'm not sure if you left us or not. Dr. Hikmat? Hello? Can you hear me, doctors? Doctors, can you hear me? Okay, good. Dr. Hikmat, have you left us?
Hello? Hello?
Hello?
Yes, doctor.
Are you with us?
Yes, doctor. Sorry, I was away a little bit.
Okay,
Okay.
no worries.
Okay.
So,
Okay.
are you happy to practice?
Okay. I will see what I will do.
Okay, do your best. Do your best.
Okay.
Okay. Where is it? Yeah, it's here. Yeah. You are talking with Mrs. Elena Robertson, and she is 39 years old. She came in the GP last week, and she has done some bloods. Okay. She is coming today for checking her blood results. Okay.
Okay.
Discuss with her the test results, please, and manage her condition. What are the blood results? Full blood count, normal full blood count. No,
Okay.
full blood count, the hemoglobin, low hemoglobin. Okay. Normal iron, low vitamin B12.
Okay.
Okay. Low vitamin
Yes.
B12. Okay. So
Okay.
these are the results. Your task, please talk to the patient, discuss the test results with the patient.
Okay.
You have 5 minutes.
Okay. Hello, I am Dr. Saad, one of the junior doctor here, GMC number 12345. I'm speaking to Miss Alice.
Yes, Dr. Alina. I'm Elena.
Yeah, yes. Are you Miss Elena?
Yes.
Can I confirm your age, please?
I'm 39 years old, doctor.
Okay, nice to meet you, Miss Elena.
Thank you.
Okay. As I can see from my file here that you are coming to discuss your blood result.
Yes,
That's
doctor.
right.
Yes.
Can I ask you few questions, Miss Elena?
Yes, of course, doctor. Yeah.
Why you did this blood test for in the first place?
Well, I was feeling a bit tired, and
Oh,
I went to the GP, and they told me, okay, we will have to have some bloods, and yeah, I'm waiting for the results.
I'm sorry for that. And how are you now? Still tired or?
Yeah, I'm still feeling tired, to be honest. Yeah.
Oh, we'll address this shortly.
Mm.
And so, do you have any complaint, any other symptom? Do you have any shortness of breath,
No, just tiredness.
heart racing?
In some occasions.
Okay, like what?
In some occasions, I feel like my heart is racing.
Okay. Do you have any fever?
No,
Any chest pain?
no,
Uh, do you have okay. Do you have any lumps or bumps in your body?
no,
Okay, no. So, do you have any medical condition I should be aware of?
no, doctor.
Any medication in regular basis you are taking?
No medications, no.
Okay. Do you have any family history of blood disease, blood transfusion, or any genetic disorder
No,
for blood? No, that's good. It's reassuring. Okay, no allergy to any medication.
no allergies.
Okay. Also, I would like to ask you for lifestyle. Are you smoking?
Not really.
Okay. Do you drink alcohol?
Just occasionally, doctor.
How about your diet? Are you on balanced diet or?
I'm vegan.
Okay. And do you do exercise?
Yes, I'm walking every day.
Okay. Miss Alice, I would like to ask you about also your ministerial, your menses.
Okay. Yeah. Yes, what do you want to ask, doctor? Hello?
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 Hello? Yes, you hear me?
Yes, yes. What do you want to ask, doctor?
I ask about your your menses is regular or no?
Yes, regular, doctor.
How many day and how much?
Um,
Heavy
yeah, it's regular for 5 days. It's
and
usual flow.
it's heavy. Did you observe it become
No,
heavy or have clots or?
no.
Okay, that's good. Okay. I would like you are not taking any contraceptive pills.
No.
Okay. You have children or no?
Well, yes, I do have two children.
Okay. So I would like now, Miss Alice, to do examination
Mm-hmm.
for you. I will check observation, including blood pressure, heart rate, oxygen in blood, temperature, and I would like to check you also generally from head to toe. And I would like to do like ECG as a routine investigation and Um, why
Okay.
I'm sorry.
Time's up.
Why I examine here? I forgot question important for B12. Maybe did you have any surgical history like sleeve gastrectomy or something?
Yeah.
Hello, you hear me, doctor?
Yes, I hear you. I hear you. I
I
hear you.
forgot to ask about surgical history of sleeve gastrectomy. Maybe
Yes.
that was.
Yes, yes. You forgot that.
Oh, I'm
Okay.
sorry. Okay,
No worries, it's fine, it's fine. So
no
how do you
problem.
feel?
This is the first time I participate with you, doctor, and I didn't study yet the test result, but this from my general information. I
Okay.
I feel I need to improve more and more and practice more.
Yes, 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 yes. I do agree with you. Practicing, yes. Okay. So no problem. You've done it
Doctor,
you've done it reasonably well. Okay. All right.
doctor, I don't know. I do examination or no? It's only test result. I maybe no need to do examination
No, you
or
can. No, no, no.
or
You've done it.
sclera for sclera and for the hemoglobin to check. She is pale. Her lips. She is pale
Yes,
or يعني.
general physical examination
Oh,
and
okay.
neurological examination.
Okay. Yeah, vitamin B12. Yeah. Yeah.
Yeah. Okay.
Mm.
So, all right, no worries. As I said, you've done it reasonably well. Okay. But there are too many questions that are irrelevant in this case. Okay. So let's discuss together. This case is a test result case, right?
Yeah.
Okay. And what are the test results? It's just anemia with low vitamin B12, right?
Yeah.
So what's your aim in your data gathering?
To exclude first bleeding during with menses more, causing her low hemoglobin, and also from the diet.
Okay, diet, I do agree with diet. But why bleeding? Heavy bleeding can cause iron deficiency anemia more than vitamin B12.
Oh,
Okay.
okay.
So she doesn't have iron deficiency anemia. She has vitamin B12 deficiency. Okay. So
Okay.
in your data gathering, your aim is to find out, does she have symptoms from this vitamin B12 deficiency? And what
Mm.
are the causes of this vitamin B12 deficiency in her case? This is in any test result. In any test result, your data gathering or your present history should be focusing on the symptoms and causes of the abnormal finding. The symptoms and causes of the abnormal findings. Okay?
Okay.
She was presenting with tiredness. You explored the tiredness, if she does have tiredness now or not. Is it getting worse? Which is really good. Okay? But you were not relevant to the vitamin B12 deficiency. You only asked me about shortness of breath and heart racing, and then you moved away from the aim of the case. You asked me about fever, chest pain, allergies, period, children, contraception, what else? Exercise and smoking. All of these are not relevant to vitamin B12 deficiency. Okay?
Okay.
Yeah, so symptoms, you ask about tiredness, shortness of breath, heart racing, tingling and numbness, balance problem, neurological symptoms, right?
Yeah. Yeah. Yeah.
Vitamin B12 deficiency, okay? So you ask about tiredness and shortness of breath for anemia in general, and then you'll be specific to vitamin B12, tingling, numbness, balance, memory problem maybe, okay? All of these are, or concentration. Okay, concentration, better than memory. These are the symptoms. What are the possible causes? The main cause is diet, okay? Then surgery, as you said, surgery on the stomach before, all right? Malabsorption, right?
Yeah.
Alcohol. She drinks alcohol occasionally, but chronic use of alcohol can lead to vitamin B12 deficiency. Okay, so diet and alcohol. I'm happy with asking with you when you ask me about diet and alcohol. They are important. But smoking, exercise, allergies, fever, chest pain, 4Ps, not important at all here in this case. It's important to ask about psychosocial. How has she been affected by this tiredness? Okay. And concerns. Does she have any concerns? You asked me about concerns?
No,
No,
I forgot.
you didn't. You didn't ask me about concerns. Okay. You check the observations. You examine the patient general physical examination and neurological. After that, you just check if the patient has any, in the investigations, you can order markers for malabsorption, and that's it. Okay?
Okay.
Yes. How can I ask about malabsorption? You ask her, do you have any chronic diarrhea? Any bowel problem? Okay. All right. So
Yes.
one of the doctors is asking me this question. Okay, so you were quite irrelevant to the to vitamin B12 deficiency. Okay.
Okay.
So yeah, good attempt, Dr. Hikmat. If it's the first time for you to practice with me in front of some people, so yeah.
Okay, thank you, doctor.
No worries, no worries.
I will, in next session, I will be
Inshallah.
always there.
It's always the first step, and then
Yes.
you go.
Okay, thank you, doctor. Okay.
All right. No worries. Thank you. Let's do the next case, doctors. Who is ready now? Dr. Muhammad البدالي. Dr. Muhammad البدالي. Dr. Muhammad البدالي. Not here. Dr. Marianne. Dr. Marianne Youssef. Dr. Marianne Youssef, are you here? Okay. Dr. Rawan Al-Sayyid. Dr. Rawan Al-Sayyid. Okay. Dr. Pariza Masood. Dr. Pariza Masood. Not here. Dr. Lida. Dr. Lida. Dr. Rizana Muhammad.
Yes, doctor, I'm here.
Okay, good.
Assalamu alaikum.
Sorry?
Assalamu alaikum.
Walaikum assalam, darling. Walaikum assalam. And lastly, Dr. Shumaya. Dr. Shumaya Ferdwas. Dr. Shumaya Ferdwas. Okay, so let's do the case with Dr. Rizana.
Yes, doctor.
Ready, Dr. Rizana?
Yes.
Good. All right.
Okay.
Are you happy to switch your camera on?
Oh, sorry, doctor.
It's fine. No worries. No worries. Okay. Well, Are you happy to do ethics case?
Ethics? Okay.
Good. Okay. All right. So you are in the medicine department.
Mm-hmm.
You are talking with Mrs. Becca good enough. She is 29 years old. She
Mm-hmm.
came in for cellulitis. She had cellulitis in her right arm.
Okay.
She is treated for this cellulitis taking flucloxacillin. Okay.
Okay. Mm-hmm.
She wanted to talk to one of the doctors.
Mm-hmm.
The nurse is telling you that the patient is angry, and Dr. Wilson, or let's say Dr. Any name, Dr. Gabriella is a new FY2 doctor in the hospital.
Okay.
All right.
Mm-hmm.
Talk to the patient and address her concerns.
Okay, doctor.
Do you want me to say it again?
She is unhappy. She was diagnosed with cellulitis and has taken flucloxacillin, and she is now angry and unhappy.
Yes, and Dr. Gabriella is one of the doctors who is taking care of her. She is a new FY2 in the hospital.
Okay.
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 Talk to the patient and address her concerns. All right.
Yeah, sure.
Okay.
Shall I start?
Do you want to take 1 minute to prepare your mind, or just start right away?
I'll take 1 minute.
Okay, no worries. Once you're ready, tell me.
Okay.
Right. Off you go.
Hello.
Hello?
I'm Dr. Rizana Nifla, one of the doctors in this medicine department. Are you
Finally,
Mrs.
someone is here.
Okay. Are you Mrs. Baker good enough?
Yes,
Can I confirm your age, please?
39.
Okay, Mrs. Good enough. May I know what is concerning you?
I'm totally unhappy with what's happening to me here in this hospital.
Oh, I see. I am so sorry to hear about that, Mrs. Good enough. Can I know how may I help you?
Do you see? Do you see? The cannula is blocked and no one is helping me.
Oh, I see. I'm so sorry to hear about that. Can you tell me more about that, Mrs. Good enough? How did you come to hospital?
I came to the hospital because I was feverish, feeling unwell. I came to the hospital yesterday and the consultant told me that you have infection in your arm. So we
Oh,
are
I
going to
see.
start the antibiotic.
Oh, I see.
Inserted the cannula to me. It's blocked and I'm supposed to take the last dose for this antibiotic tomorrow. And by this delay, I'm not going to take it on time. I
Oh, I
asked
see.
the nurse didn't manage. Your colleague, her name is Gabriella, I think. I told her about that. She told me I'm going to come now, and she didn't come.
Oh, I see. I can see, Mrs. Goodenough, you are not happy about this. I understand anyone in your situation would feel so. Okay, I'm here to help you. May I know how long it was delayed for your injection?
2 hours.
2 hours. How is your hand now? Any improvement?
I don't know. I'm taking the antibiotic. I'm feeling okay now, but the cannula's blocked.
Okay, I can see, Mrs. Goodenough, that I'm here to help you. Can I ask few questions other than this cannula block? Do you have any other concern?
Nothing.
Mm-hmm. Okay. Have you been diagnosed with any medical condition?
No.
Are you allergic to any medication?
No.
Mm-hmm. Okay, you said that your symptoms have improved. Do you still feel any fever or any pain in your hand?
No, I don't have any fever or pain.
Oh, I see. Okay, and due to the cannula blockage, do you have any pain over your hand?
No.
Mm-hmm. Okay, so I am here to help you. That you said my colleague was here and she disappeared. Okay, I would inform my colleague or in that if she is unable to come, I am here to help you with that to change the cannula. Is it okay with you?
Yes, if you can't change the cannula, please change it. No one is changing it to me.
Okay, okay. Don't worry, Mrs. Goodenough. I'm here for that. And do you, other than that, do you have any other problem so that I can consider that?
Yes, the last dose of the antibiotic is tomorrow. It should be at 10 o'clock. By this delay, I think I'm not going to take it at 10 o'clock. And I have to go to my work.
Okay, I'm here for that purpose only, that we will be able to arrange the new cannula and we will be able to give the next dose on time. And you said you are in a hurry to go. May I know why?
Yeah, I do have a conference in my work, so I have to attend it.
Oh, I see. I feel that you will be able to go on time. In case if you don't get time or if you in case you delay, we can help you by giving you any letter or any note. Is that
No,
okay?
it's not going to work. Thank you. Time is done. Time is up. Thank you, Dr. Rizana. Thank you so much.
Okay.
Sorry, I was a bit difficult. Okay. So how do you feel?
I was confused about the data gathering. How can I do in this case?
Yeah, good. I'm happy with the mistakes, and I'm happy when someone is confused about how to gather the data, because this will help us to know, you know,
Improve.
thinking about what is the appropriate data gathering in each specific case. Okay? All right. What is the situation, Dr. Rizana? The patient in the hospital, she's treated
Yeah.
for cellulitis. She
Mm-hmm.
is she's on antibiotic. Her cannula is blocked. Her cannula is blocked, and she's unhappy. All right? She's
Yeah.
unhappy, and her cannula is blocked. What could be the data gathering? Her
About her
cannula is
current
blocked.
symptoms of cellulitis
Okay. And
and symptoms of cannula block.
yes. So you ask her about pain in her arm due to the blocked cannula or any swelling. Okay, this is one of the main points in your data gathering. And you have to look at the site of the blocked cannula, remove the cannula, and insert another cannula, right?
Mm-hmm.
Okay, this is one part of your data gathering. What is the second part? She's angry.
You have to validate her concern.
Identify that she's angry, right?
Yeah.
She's angry. You identified. So you have to acknowledge. Okay?
Mm-hmm.
How to acknowledge? I can see that you are quite
Unhappy.
upset. I can see that you are quite upset.
Can we say upset?
Upset or unhappy, whatever. Sometimes you can say angry, it's fine. It's not a very big problem. As long as what you can see. Yes, some people avoid saying angry. But if you say it if you say it just by mistake, it will not affect you very, very much. Okay?
Mm-hmm.
So I can see, acknowledge, highlight. I highlight that you've seen that. Okay? I can see that you are quite, because
Unhappy.
she was quite upset, not a bit. Okay? So you are quite upset, you're quite unhappy, you're quite frustrated. All right? And I'm here to help you. Okay? And I'm here to help you. Could you tell me why? Why are you upset? Like that.
Mm-hmm.
This is one point, or the first question in your data gathering in this case. Okay?
Mm-hmm.
Why? Why are you upset? Okay?
Doctor, one question. Can I recap, can I paraphrase, like seeing her? I can see from my notes that you have been admitted with cellulitis.
Yes, you
Like,
can paraphrase that, but after identifying and acknowledging that she's upset. If she's
mm-hmm.
upset, if she's showing non-verbal clues and verbal clues that she is upset, identify, acknowledge, and ask her why first, why she is upset, and then you can paraphrase.
Mm-hmm.
Okay? Got me?
Mm-hmm. Okay.
This is the logic way in dealing with the situation. Okay?
Mm-hmm.
If she is not showing uh, signs or clues that she's upset, then you can paraphrase from the start. Okay?
Okay.
So it's
Mm-hmm.
based on the situation. I was unhappy from the start, right? So
Mm-hmm.
acknowledge, identify, and then acknowledge, and then ask why. And then you can paraphrase by telling her, yeah, I can see that you're in the hospital and for infection for your arm. Do you still have any pain, any fever? How are you doing right now? And for the blocked cannula, do you have any pain or swelling in your arm? Okay. You don't need to ask about medical conditions
Oh.
or medications or allergy.
Mm. All right.
Is it related to the situation?
Not related.
Okay. So this is the art of thinking about data gathering.
Okay.
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 Think about the situation, the question, the context, and the management as well. Think about all of these. You will be able to gather the right data. Okay.
Mm-hmm.
You can ask her about how has she been affected by this admission as part of your report by asking some psychosocial histories, right?
Mm-hmm.
What is the effect of this admission on her? Once she tells you I'm going to have you know, a delay in my in the medication and I have to go to my work, ask her what's your work, what's your concern exactly, so I can help you sort things out for you. Okay, all of these are questions in your data gathering that you can ask, which is logic and relevant to the situation. Okay. What else? Then you can check her ICE, ideas, concerns, expectation. You can ask her ideas here, not very relevant to be honest. Okay. You can ask her, do you have any other concerns? Are you expected anything from us to do today? All right. So even ideas, concerns, expectation, you can filter them based on the situation. Okay. Examination, check observations, check the cannula, change the cannula, and that's it. Okay.
Okay.
So this is your data gathering in this case. So the data gathering differs from approach to approach. Okay.
Okay.
Here, we skipped investigations. We don't need investigations, to be honest, in this case. Examination is important just to assess the patient if she has any problem with the blocked cannula and to change the cannula.
Doctor, I
It
have
is
a
logic,
question.
right? It is logic. So it is logic to do that. In history, we don't need to ask about personal history, past history, 4Ps, anything which is not related. It's not related to the situation. Okay,
Mm-hmm.
got it?
Yeah, she was talking about the Dr. Gabriela. Should I tell her regarding that doctor who vanished?
Yeah, good that you've raised this. Well, you tell her, okay, I'm really sorry for, I'm really sorry for the experience you had, okay? Or I'm really sorry for what happened. I'm not sure what happened with Dr. Gabriela. I will have a talk with her to find out what happened exactly with her, and she will definitely come back and talk with you. When you say sorry to the patient about an experience with the colleague, don't blame your colleague. You don't know what happened, okay?
Mm-hmm.
You always say, I'm really sorry for the experience. I'm really sorry for what happened. I'm really sorry that you felt that way, okay? I'm not quite sure what happened with Dr. Gabriela. You can say maybe because she is new in the hospital, maybe she didn't manage to come quickly. You can say that maybe, but let me talk with her about what happened, and she will definitely, don't
Come
tell
and
her,
talk.
and I will tell her to talk to you. No, and she will definitely get back to you.
Mm-hmm.
Okay, this is how to deal in the situation which there is a problem with one of your colleagues.
And I can tell that anyway, I am here to help you. I can change the cannula.
Yes, yeah.
Mm-hmm. Mm-hmm. Okay.
All right.
All right. Thank you. Thank you,
Okay.
doctor.
Thank you, Dr. Rizana.
Yeah.
So this is in terms of the data gathering in ethics, angry patient. We have taken one of the cases in angry patients. We cannot generalize the data gathering in all of the cases of angry like what we've done, okay? We think about the situation, we read the question carefully, and we filter questions based on the case. But if we generally speaking, You focus always on the present history and on the psychosocial history in ethics. Okay? All right?
All right.
Okay. Let's do the last case with Dr. Isra because the doctors in the list, I'm not sure, they didn't manage to attend. Why? And they wrote their name, but it's fine. Dr. Isra, are you ready?
Yes, doctor.
Okay, let's do the last
Yes, yes.
case with you. Happy to switch your camera on.
Yeah, no worries.
Okay, no worries. Okay, Dr. Isra, you're Dr. Isra. I didn't know that you were Dr. Isra because your voice is a bit different today.
I'm
Or-
having just pharyngitis, so
Okay, good, darling. Yeah, I hope you speedy recovery. All right.
you too.
So yeah. Okay. Another ethics case.
No worries.
Okay. All right. You are talking with Mr. Any name, Adam Brown Sword. Okay. He is 80 years old, in the hospital, in medicine department. He is treated for pneumonia since yesterday. He wanted to talk to one of the doctors because he has some concerns. Please talk to the patient, address his concerns. All right. As an additional information, the patient has cancer lung, okay, and the cancer is responding well to the chemotherapy.
Okay.
All right.
Okay.
Okay.
So Adam Brown, 80 years, admitted yesterday due to pneumonia. He's receiving treatment, and he's a known case for
He
cancer,
is.
lung cancer. He's a known case of lung cancer and
Yes.
responding to treatment.
Yes.
Okay, and he would like to talk with the doctor. Okay.
Yes. Okay. I do have cannula.
Having a cancer.
Cannula in my hand. Okay. All right.
Okay.
So let's get started. Data gathering. Just give me a second. Just give me a second.
Sure. Yes.
Dr. Isra, and all of you doctors, do you mind if I have 5 minutes to pray? Because the time of prayer,
Yeah, absolutely.
after prayer, yeah. So
Yeah.
just 5 minutes to pray, and then we can resume the last case. It's only the last case, okay? All right.
Yeah, sure.
Thank you so much. Yeah. Hello, doctors.
Hello.
Can you hear
Hello.
me?
Yeah.
Thank you. Dr. Isra is here or she's praying? Yeah, okay. All right. So let's get started, Dr. Isra.
Yes, sure.
Yeah,
Okay.
start.
Mr. Ali, agency number 806-9908. Hello.
Hello.
I'm Dr. Ali, one of the doctors in the medicine department.
Hello, doctor.
Are you Adam Brown?
Yes, doctor.
Could you confirm your age, please?
I'm 80.
Okay. And is it okay to call you Adam for today?
Yeah, it's fine. Yeah.
Okay. So I can see from my notes that you've been staying with us due to problem with the chest, in the chest. Is that right?
Yeah. Yes, I'm having infection in my chest. I'm taking medications through my vein. Yeah.
I'm sorry about what you're going through. So I've been told that you would like to talk with a doctor. So how can I
Yeah.
help you?
Yes. Well, the nurse was trying to convince me to take the medications for cancer, but I'm about to have the second cycle tomorrow. Okay.
Okay. Yeah.
She was trying to convince me, and I don't want to take it.
Oh, I see. So may I know, Adam, why you don't want to take the medications?
Well, I had enough in my life, and I think it's my time to go.
Oh, dear.
Yeah, I don't want to take these medications anymore, doctor.
Okay. So Adam, I completely understand what you're going through. It must have been hard, this trip for you. So do you mind if I just ask you a couple of questions and then maybe we could just have a chat and you could change your mind?
Okay.
Okay. So what sort of symptoms did you have in the first place?
Regards my chest infection.
Regarding your the lung cancer, I mean.
Oh, okay. I had chronic cough for a long time, and then I went for many investigations, and then they diagnosed me as lung cancer. Yeah.
Okay. So with this, you do have shortness of breath.
No, just occasionally, doctor, and I think they told me the treatment is good, but
Yeah.
I don't want to take it anymore.
Mm-hmm. Okay. So do you feel like this treatment is benefiting you? Do you feel better?
I don't know. I don't know. I don't know.
Okay, no worries. So did this treatment have any side effects? Is it bothering you?
No, no side effects. No side effects. No.
Okay, understandable. Other than the lung cancer, do you have any other problem, medical problem?
No other medical problems.
Okay. So for how long are you being treated?
For 3 or 4 months, I can't remember, doctor, to be honest.
Okay. So now I know who do you live with, Adam?
I'm living alone.
Mm-hmm.
My wife passed away, and
I'm sorry.
my friend passed away as well. Yeah.
Oh, I'm sorry for your losses. Do you live at home or somewhere else?
No, I'm living at home. I'm doing everything by myself. Yeah.
Okay. And were you affected by this disease? I mean, did it stop you from doing things you used to love?
Not really. No.
Okay. Do you have a nearby family or friends?
Yeah, my daughter, but she's living far away. She has osteoarthritis as well. She
Mm-hmm.
has enough in her life.
Mm-hmm. I see. So, are you able to to go out, to do, to walk around, having things you love to do?
Well, I don't have the energy to do anything, doctor. I feel this is my time, and I just need to stop anything and pass away peacefully.
Yeah, I'm really sorry about the way you're feeling, Adam. So may I know how much you know about your condition, about the
Parents.
lung cancer? Okay.
All
It's confusing
right.
me, this Mr. Adam.
Thank you, Dr. Isra.
Yes,
All
yes, you're
right.
welcome.
Well, I would love if you asked this question once I told you I don't want, after asking me why you don't want to take the
Okay.
medication. Okay.
Yeah.
Well, maybe because this is an ethics case, you can just gather some data and
Yeah,
then
and
go
then
on in the
put it in
management
the,
and come back. Okay.
yeah.
But I wanted to, to know how we're going to deal with the case in general.
Mm-hmm.
Okay, so this is a refusing patient, right?
Yeah, yeah.
So what's the aim in your data gathering in any refusing patient?
Okay. I would like to get their understanding of the situation,
Okay.
including the benefits and the risks. Okay. And then I will explain and tell him about the benefits and risks in the right way if they don't have the right information. And then to negotiate if I could,
Negotiate, yes.
yeah, if I could
Not
convince them or
convincing,
not.
yeah,
No, no,
negotiate with them. Yeah,
yeah.
okay, good. All right. I'm happy with your understanding about the case. Your interpersonal skills were very, very good, very good. Okay. The questions that you asked me, I was concerned about one of the questions. You asked me about the symptoms that I had
Yeah,
before
yeah.
having the. Do you have any purpose for that or?
Yeah, so if he was receiving, he was having severe symptoms, and then he started treatment, and now he is improving, maybe I could convince him that he would be
Okay,
living better in the
yeah,
future. Yeah.
I got your
Yeah.
point. Okay. Well, okay. I would say it's a good way to deal with it, but with the time limitation,
Yeah.
you can just highlight that about highlight the improvement. Do you feel any
Okay.
improvement of your symptoms or not?
Okay.
Okay,
Yeah, much better.
just for the sake of the time management. Okay.
Okay.
So you acknowledge that he doesn't want to take the medications. I didn't feel that you acknowledged from the start, or you told me why first.
I asked you why, and then you said I'm just fed up, I'm tired.
Yeah,
So I
yeah,
said I'm sorry. It must be really hard to go
yeah,
through all of this.
yeah. And always show the patient that his decision is respectful.
Yeah.
Okay.
Okay.
All right. Tell him, okay, well, okay, this is your wish, and we have to respect that. But let's have a chat. Maybe you can change your mind. Maybe you told me maybe you can change your mind, but before that, tell him, okay, it's totally
I understand.
respectful.
Yeah.
This is your wish, and we can't force anyone to do something that he doesn't want to do. But just let's have a talk. Maybe I can, tell you my point of view as a doctor. Maybe you can change your mind. Okay.
Yeah.
After all of these questions, you can ask him what is his understanding about his medical condition now, and what will happen
If he stops the medication.
if he didn't take the medications. It's
Yeah.
very important. And lastly, in this particular case, stopping of the medication can lead to end of life, right?
Yeah.
So one of the points in your data gathering is asking about CPR. or respect form. Does he
DNF.
have any respect form to fill? Does he have any wishes regarding his treatment if things deteriorate? Okay,
Okay. Yeah.
so it's one of your points in your data gathering in this case.
Okay. So I was planning also to put it back, but should I ask it in the psychosocial part immediately before
No,
starting
no,
the
no,
negotiation part?
no. You can
Because
ask
I
it.
was planning maybe if at some point I felt he's still refusing, I could then say, okay, so if you still don't change your mind, can I ask you about the
Yes,
DNR
you
and
can
the
at
wishes?
any
Okay.
point in the case, but make sure
Okay.
that you fulfill it
Mention it.
during the 8 minutes.
Yeah.
Okay, all right.
Okay.
I'm just highlighting the main points in your
Yeah.
data gathering. In ethics, we cannot say the case should be 2 parts, data gathering and management.
Yeah.
It's ping-pong consultation between you and the patient. You can gather some data and then manage in the middle and then come back to the data gathering because it's a conversation. It's not it's not medicine case, all right?
Yeah.
But because we are focusing on the data gathering, I'm just highlighting the main points in your data gathering that you have to fulfill in this
Okay.
case. All right?
Yeah.
Okay. But good. Good.
Thank
All right. Thank you, Dr. Isra.
Thank you, Dr. Zah.
Thank you. All right, doctor. So I think by the end of this session, we are at the end of the session. So I think now you understand very well how to gather your data based on each case, based on each question, based on each context, on each situation, on the symptom, all right, on the information that you have from the question or from the patient, on the circumstances, okay? So you have to think about these main points to be able to gather the right data in the case. If you don't gather the right data in the case, you're not going to manage the case properly. Okay, that's why the management in most with most of the doctors is low. It's not because they have to say everything. No, they missed few things in the data gathering, and it affected the management. All right. Yeah. So I will have with you 5 more minutes. If you have any question, please do ask. And please, I'm going to share with you a quick poll about the session. How did you feel? And what are your suggestions? Please, please do participate in this feedback. It would really help me. Please. Okay, I've launched the feedback. I will leave it for 5 minutes until I answer your questions. Please do participate. Very importantly. All right. Yes, Dr. Isra, you are raising your hand.
So I've got a question, doctor, regarding the driving. In a cataract patient, if she presents and she mentions the part that she's not able to see, but she's still driving, should I ask her to inform the DVLA immediately, or I should send her to the specialist, and then after her discussion with the specialist, she should inform? I know I would advise her to stop driving. This one I'm quite sure about, but what about the informing part?
Okay. So if you just advise her to stop driving, you've done your issue in the
Okay.
case.
Okay.
Okay?
Yeah.
Informing the DVLA based on the confirmation of the diagnosis. And then once confirmed, she will be able to tell her, you know, the DVLA. All
Perfect.
right.
Okay. Yeah.
Advise her just to tell her, I highly advise you to stop driving, and also you can confirm the DVLA about your problem. Once it's confirmed, you can also, you know, update them about that.
Okay.
Yeah. All
Perfect.
right.
Thank you.
Thank you, Dr. Isra. Any other question, doctors? Any other question? Everything is clear in the session. Was it helpful? Just write in your feedback.
Yes,
Uh,
doctor.
who's okay?
Yes, I'm Dr. Hikmat. Yes, doctor.
Yes, Dr. Hikmat. Yeah.
Yes, doctor. I will be able in exam, inshallah, to know this is like a case of mainly history-based approach, mainly this one. I will be able to know this one, or I mean in the card, or they will give me in the exam. It will be showing what is the main concern, like this one, or you get me? You get my point, doctor?
I didn't get you fully. Do you mean do you mean are they going to give you the question?
I have no. I mean if I have cases like because sometime I saw the recall.
Mhm.
Doctors write it like only as the diagnosis. I
Ah,
mean, if I need to explain test results, I know from the question they will tell she
from
came
the
here to
question.
know the test. Oh, she came to know the test result.
Yeah.
But some all it will be like this. And I will be able to know all or
Yes, of
uh,
course, darling. You will be have the
the,
question.
the ethics also it will the question it will be clear that I know it's only ethics, not history based approach, not like this one.
Well, okay. What I understand that you are asking about the question, are you going to be able to know, or they are going to provide you, is it a history-based case or ethics case, or what is the approach? Do you mean this?
Yes.
Well, no, you have to read your question and put it by your effort in the right approach. Okay, so they will provide you with the question. From reading the question and from understanding the situation, you will be able to put the case in the right approach. A patient who they provide you with the question telling you, Mr. blah 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 blah, he is coming in the GB because of headache, right? This is the question. So you able to put it in history-based case, right?
Yes.
Yeah. So this is your ability. I mean, a patient who is unhappy, they are telling you in the question, a patient who is in the hospital, blocked cannula, the patient is unhappy and wants to talk with you because he is upset.
Yes, it's clear. Yeah.
This is an angry patient, okay?
Yes.
So you will be able to put the question in the right approach, but they don't provide you with which approach is it, okay?
No, I know they will not provide me with which me I will be able. I mean
Yeah.
the question will be clear that
Yes.
what you said now right now.
Yes.
Okay.
Yeah.
So yeah,
All
okay.
right.
Thank
Okay.
you, doctor. Thank you so
Yeah,
much.
thank you. Thank you. Thank you so much. All right. So, yeah. Thank you so much, doctors, for attending, for participation as well. Thank you, Dr. Ahmed. Thank you for your words. Yeah, I'm happy that you found it helpful. Please, if you find the sessions helpful, share it with your colleagues, share the links with your colleague. By this, you're helping your colleagues to know about you know, the sessions and how helpful they are. And yeah, thank you so much, and all the best, doctors. See you in the next week, inshallah. Next week will be, I think, a teaching gem. I'm going to teach you. I didn't decide yet, but I'm going to teach you a specific topic, and then we can do 2 cases on this topic as a mock, you know, teaching and 2 cases. Okay. Yes. See you inshallah. Bye bye.
Bye bye. Thank you.